To begin with, we have a question for you. And that is, are we a healthy nation? How would you answer that? I got to know. I got a few people doing this neck exercise. Well, we spent more in healthcare than any other nation. And out of the 11th highest incoming countries in the world, besides that we spend more in healthcare, guess where we ranked in terms of health of the population? Number 11. Out of all the industrialized nations, 37 or so, we rank again at the bottom of the barrel, about 35th. That's measuring infant mortalities. More babies die within the first year of life, and we live less long than most industrialized nations. During the height of COVID, we had the second leading death rate besides the United Kingdom. Now, was it a different bug that came over here and got us? No, it's the same bug. But we were a sick nation. People with heart disease, cancer, diabetes that you don't find in the rates that you do in other countries. Now, I'll tell you why I bring up these statistics. It's not to depress us, but we spent over $4.6 trillion on healthcare, more than any other nation. We have more doctors, more hospitals, more technology than any other nation. We make and take more drugs. We are 5% of the world's population, consuming 60% of the world's drugs. And some studies say a little higher than that. But are we healthy? And a corollary question, we could double this, 4.6, and would you and I be any healthier? We would not. Why is it we're not a healthy nation? And you see, this is the point of this, is not to depress you with these statistics, but to get us to think why. And I asked that question a long time ago, and that's why I studied this thing called health. See, I contend we're not a healthy nation because we don't know what health is. And I'm leading you into my trap when I say that, because how many people we know who feel good, they feel wonderful, and then they come out, shovel snow, and it might, the way our weather goes, it could be tomorrow, it could be 62 degrees, and they drop with a heart attack. Or you come out of the doctor's office, you feel great, and then you're diagnosed with cancer. See, the fact is your heart will dysfunction. This is what research shows, for 3 to 5 years replacing with abnormal muscle tissue without ever having a symptom. Most cancers are 10 to 12 years of us feeling good and thinking we're healthy. Now, why do we believe that? Why is the end game to feel good? And that's really what healthcare is. It's not healthcare, it's treating a disease till you feel good. Well, I'll tell you why I found this to be the reason. Have you heard this? When you have a headache in the evening, you take Excedrin, what, PM. You're old enough, you have Tylenol for who? For juniors. How do you spell relief? RLAIDS. If you know that one, you're showing your age like my age, right? Why do we know that? Because it's $8 trillion spent a year by the pharmaceutical industry. And what do they spend it on? Research and development? No. 2 out of 3 commercials are about a drug. And this is how crazy it is, folks. Here's Billy with his father. They pan in, the music's nice. It's never a rainy day. These commercials are always bright and sunny. They pan in on his skin. He's got beautiful looking skin because he doesn't have his eczema. Then the music gets a little softer, the light's a little brighter, and they get to what? Not the side effects. That's Fifth Avenue. That's their direct effects. He's got diarrhea the rest of his life. His eyeballs might fall out. Death is a possibility, or maybe lymphoma, right? And I'm not exaggerating. And guess what? We still take the drug because we are brainwashed to believe, and again, it's normal to our culture because it's the conversation around the dinner table that whatever you do to feel good, you're healthy. And health is not how you feel. And in the opposite end of the spectrum, does the presence of symptoms mean you're sick? We had 3 kids, raising them, and we may had 6 or 7 fevers, and they would last 12 hours, maximum maybe 24, and the fever would be over. And our child was never sick in our mind. Because I know the fever is the body's way of burning off a virus and a bacteria. In fact, if you didn't produce the fever, you'd be in trouble. But we've been trained to believe that the fever is the enemy, and that it shouldn't be there. Well, guess what? When your body's out of balance, it's going to raise its temperature. And if we get congested, your body's going to produce mucus to get rid of the toxins. What we've been trained is to blow something up our nose to dry out what the body's produced to heal itself. So you see, we've got it bass-ackwards, if you would. Health is not certainly the absence of symptoms. And the presence of symptoms often is a sign that the body is healing and doing exactly what it should be doing. When you're functioning right, you may feel like garbage. You may have a fever. Your muscles may be achy to get rid of something. But certainly, when you're functioning, most of the time your body's going to feel its best. Your liver every 6 weeks, where's that tricky devil there he is replaced with all new cells. Your stomach lining every 3 to 5 days, your heart every 3 to 4 months. Within 1 to 2 years, every single cell in your body has regenerated. And we are either in that process or our cells are replacing abnormally. And this is the thing, the body does not repair sick cells. It's either in this process or it's in this one. And when we're creating abnormal tissue from those cells, we create organs that are failing, systems that are not working in harmony, and then eventually we have a disease, which is there for how long? Weeks, months, commonly years, before the symptoms start. And what we are commonly instructed to do by the allopathic medical system is get rid of your symptoms, but do nothing about the process. Health is not the absence of what? Pain or symptoms. In fact, pain or symptoms are the last 2 warning signals to occur with most disease processes. Research indicates how many years for heart disease to develop, folks? 3 to 5. I'm glad I heard what I said. And 10 to 12 for cancer or degenerative diseases. And 100% health, though, is achieved by 100%, what's the magic F word? Function of your body. And in order to have a healthy body, my body must have healthy what? Cells. Thank you. And the quality of my life is the quality of my cells. Now, this is the Dorland's Medical Dictionary definition of health, also the World Health Organization definition. We're going to spend a minute on this because it's important. It states health is a state of optimal or 100% physical, emotional, they say social, but don't get that written down yet because I have a literary license, I'm speaking. I say spiritual and social well-being. Physical, emotional, spiritual, and social well-being. Now, the reason this is kind of crucial, right? Health is a balancing act. Just like the chair you're sitting in, if one of the legs is weak, what does it do to the other 3 legs? It puts a lot more stress on them, correct? So you could be in great physical shape, but come home and have no love in your life, be socially awkward, or not even awkward, just be off in a relationship. And can you be healthy? No, you can't. We have to express love, we got to give love, we have to receive love. Or you could be the greatest lover, but if you have no spiritual underpinnings, and you're stressed during a life-changing event, sometimes it's moving, could be stressful, a divorce or some other health issue, and you don't see a reason for that or something bigger than yourself to help you get through that, you may never get through it. So the homework assignment here is maybe where are we not working on one of these health principles? Because it's hard to work on all of them. And spiritual might mean going to church, mosque, synagogue, or it might mean walking in the woods and taking more time alone. A walk in the woods lowers your blood pressure. A walk in the woods allows the microbiome in your gut to be replaced with normal bacteria more than taking a probiotic or eating a yogurt. A walk in the woods is the greatest way to get negative ions, which in this case is positive, and antioxidants produced in your body. So in our workshops in our office, we go through the strategies for all of these. And look at this. This is the odd part of this. Not merely the absence of disease and infirmities. Why is that odd? Because that's the whole focus of our medical system. And listen, our medical system is great. If you're in a crisis care, it's the best. But if we want to be healthy and burn like a candle and flicker out at about 100 years of age, we're not doing it focusing on the absence of disease and infirmities. It is the promotion of health and the maintenance of the body functioning at 100%. In fact, according to Webster's dictionary, health is a condition of wholeness in which all of the organs, tissues, and cells, what's that magic F word, are functioning 100% of the time. In our bodies, the most important structure is your spine because everything pivots into it. Your legs pivot into it, your arms pivot into it, mechanically. But also your nerve system is what perceives your environment. Nerves perceive emotional stress, and that vertebra get affected, their alignment and their motion. Nerves perceive chemical imbalances, pesticides, preservatives in the food, garbage in the air and the water. The nerve system sends a message to the brain responds. Alcohol. And sometimes it's not one of those stresses, but a combination of them that will affect how this nerve system works. So we want to go through today some of the ergonomic, structural things we need to do to keep our spines strong and healthy so that we don't have as much work to do here in our chiropractic office. So number one, what do we spend a third of our life doing? Sleeping. So sleeping, number one, when you sleep, you heal more than any other time. Getting a good night's sleep is crucial. The best mattress lasts 10 to 12 years. 30-year warranty doesn't mean anything. The best mattress is a latex foam coil. Latex foam coil. Memory foam with coil, okay, but latex foam coil. Not the firmest, no number specific. Nothing that conforms to your posture. I've never met anybody with perfect posture, and I observe everybody's posture. So again, not the firmest, one level down. The firmest is like sleeping on a bed of concrete. Doesn't matter how old your mattress is if you don't flip it around every 30 days, head to foot. And this is why I don't like pillow tops, because you cannot flip them. You can turn them, but if you don't turn and flip, you're lying on the same bellows. Every 30 days, that thing's got to be turned. So the mattress is important. It must be quiet and it must be pitch black. You must have darkening shades. And it should be, and this is a point of contention between my wife and I, who likes it like a sauna, the temperature should be 68 to about 71 degrees, generally. Everybody's different, but generally. Your pillow should be 50% feather, 50% down. That's kind of hard to find. Generally, most pillows are not feather and down. They're foam pillows, and generally foam pillows are not as good. They say you get your best night's sleep when your bed is for sleeping only. We said maybe one other activity. The point is you're not watching TV, you're not reading, you're not eating, because subconsciously when you go to your room for sleep and you know it's just sleep, you're going to sleep better. Sleeping positions. Number one, for most folks, no stomach sleeping. Because when you sleep on your stomach, you got to tuck your chin in or to the side. That irritates all the structures of your neck. Crowds the heart and lungs, weakens your stomach muscles, weakens the lower back muscles. So if this is my mattress here, back or side, those are the options. If you're on your back, and get this concept because it applies in every other standing and sitting position, put a pillow under your knees. When you put the pillow, you relax the psoas muscle. That relaxes your lower spine. So to get that muscle relaxed in bed, it's real easy. Just put a pillow under your knees, one pillow under your neck, thin. The most common faulty posture in North America is the forward head tilt. I have some of that. Your head is out here. I call it your head walks in 5 minutes before the rest of your body when you go in the room posture. So thin pillow if you're on your back. If you're on your side, pillow between your knees, take stress off your hip, your knees will stop you from turning on your stomach. Thicker pillow, because you have to make up the breadth of your shoulder here so your head is neutral. Now, when you go to get up out of bed, don't pull up from lying on your back. Turn on your side, push off with your elbow and your hand, and let yourself sit for a few seconds. I see more people with tinnitus, vertigo, and not just in seniors, because they're not giving their equilibrium, their vestibular system, a moment to set. We're constantly on the go. So just count your blessings, say an affirmation, and some of those things we teach in the workshop about keeping your mind right, but don't spring up from lying after you've been in bed. Now, to get a good night's sleep, change your sleep habits. If you're reading, watch TV. If you watch TV in another room, start reading. Do some thoughtlessness meditation. One of the purposes of yoga, which we're going to get to, is to prepare the body for meditation, and that will help you sleep. When you're stressed, it's really crucial to get a good night's sleep. And this is the thing, folks. You do not make up sleep if you don't make it up. In other words, you don't catch up on your sleep if you don't catch up within 48 to 72 hours. In other words, if you lose sleep, that's going to have a negative effect on your body. If you can catch up within 48 to 72 hours, your body isn't going to be dragged through the mud with a lack of sleep. Again, try winding down, no TV, no work. Do a few yoga poses. Again, one of the purposes of yoga is to prepare your mind for meditation, and that will certainly put you to sleep if you're tired. Take a sleepy time cocktail. That's not your favorite adult beverage, but melatonin, 5-HTP, 5 milligrams there or so of melatonin. This kind of knocks me out, melatonin. I wake up a little groggy, and I don't take this regularly, and you don't have to take things regularly. Even children could take this kind of stuff, just to get you in a good sleep cycle. And the other one is magnesium citrate, is also a really easier way to try to get a good night's sleep. Enjoy a warm herbal bath. Do not eat late at night. One of the major things that will help you need less sleep and get a good night's sleep is exercise. But I got to tell you one other thing that we didn't cover here, and this is the most amazing thing. As I said, I've been doing this thing for many years, 40 years, this thing called adjusting people's spines. And I would always tell people on the first visit, you're going to get a great night's sleep. And I didn't know why. I said it anecdotally because people would tell me, oh, Doc, I slept better than I did in years. Now I found out the reason why. And this is kind of not that recent, but research that just came out 5-10 years ago. We have something called the glymphatic system, not the lymphatic system. The glymphatic system is when we sleep, the periarticular ducts, the ducts around our arteries in our brain that carry cerebral spinal fluid and kind of give the brain like a car wash, swell to 60 size, the 60 size more than what they are when we're awake. And cerebral spinal fluid is very greatly affected, and this is work with Damadian, the founder of MRI, now his son, and 2 chiropractors in upstate New York who do a specific upper cervical technique, so it is specific for this technique, that it improves cerebral spinal fluid flow. They have this on CT scans. It sucks up cerebellar tonsils, which is the base of your brainstem coming in, well, not the brainstem, but your cerebellum coming into your spinal canal. So the power of an adjustment is something that increases not only how nerves function and allows them to function normally, but it affects this flow of cerebral spinal fluid, which is pumped up and down the spine and all around the brain. So now I know the research as to why. So in your handout are these sleeping positions on your back to review, pillow under your knees, on your side with a pillow between. When you go to get up, push up with your elbow in your hand, which brings us to standing posture. And a general word about footwear. If you're wearing high heels, and hopefully that's not the men, but not that there's anything wrong with that either, don't go from wearing a high heel all day to a flat. and you may not wear high heels, but you may know someone who does, because that puts a tremendous stress on the lower spine. So wear an intermediary pump before you go from a high heel to a flat. The other thing is your sole, general word, your heel should not be more than twice the height of your sole. These are pretty good. Clogs, god-awful ugly in my opinion, are not that bad because they have this big sole in the front, but the heel is not more than twice the height of the sole. And you need a good arch. The new thing is Converse. They're not new, they're old and Pro-Keds, but they're making a resurgence and they have no arch. Kids, adults are wearing them, so if you see people wearing them, they need to put some kind of support for their arch. So here's this young lady just putting her foot up. But the other thing you can do is tuck your pelvis. Pull your belly in, suck down like you're squeezing a penny between your cheeks, and you're breathing. Whenever you breathe, whenever you tighten core, you must breathe. You need to keep your hamstrings stretched. All right, you need to keep these stretched. You need to keep your back loose, which is stretched, and you need to strengthen your core. So there are a lot of things you can do to strengthen your core, yoga positions, plank poses, lots of different things. It's not having a six-pack, it's having the deep core muscles strengthened. Sitting posture. Number one, sit with your ankles crossed here, never anywhere on your knees. So if you're going to cross your legs, at the ankles only. No wallets in your back pocket. When you sit on one of these two bones, your ischiums, and it's like walking around with a salami in your shoe, right? Because you're throwing everything off. No wallets in the back pocket. Avoid soft chairs. They should be firm, and your chair should be at 120 degrees, not at 90. Now, most car chairs, you can do that. In fact, you can raise your knees higher than your hips by elevating the front of the chair. But it should be at 120 degrees. Anybody here do computer work? Okay, we got a lot of you guys. So, number one, you don't have this slide, so don't go crazy looking for it. Your phone should be on your left-hand side. So I'm answering the phone and I'm doing this at the desk. I'm never doing this. Word of technology, phone texting, here. Not like this. Right up here. Same thing when you're on your computer. Phone is here. Your computer screen is right in front of you. It's hard to get your eyes in the middle of any computer screen because you cannot get your chair low enough. So if you look at our workstations throughout our office, you will see we have a little desktop which we put the computer monitor on, or even your laptop. It increases your workspace underneath it, but you need to elevate the monitor. Change your gaze. If you're doing anything for any amount of time, any duty, change your gaze. In other words, if this is my computer monitor, or say this is my computer monitor and I'm typing and my eyes are in the middle, I'm going to look at that chart over there when I'm not typing and thinking. So you're not doing continuous motions in the same way for hours. And you should not do anything more actually than 40 minutes at a time. Because any duty requires a different amount of thinking, typing, so change your duty every 40 minutes or so. Your elbow should be at 70 to 90 degrees. And that is, you should have your hand linear and your elbow not reaching out. Now the hand linear applies with anything you're doing to strengthen your wrist. So the purpose of your nervous system is to control, what's that magic F word? The function of every tissue, cell, and organ in the body. That allows the cells to regenerate, eliminate toxins. Now, an interference to those nerve fibers, well, that's a whole different experience. So here it is, my son is functioning with all of these organs working well, and he's 12 years old, I think, or so, 13, and he goes on the student exchange. He goes to New Zealand or Australia for a month. Great opportunity, the Eisenhower program, but he eats a terrible diet. Things he's not used to. Salty, monosodium, glutamate, all that garbage. Now his body's got to deal, that same intelligence that created him, with a bunch of chemical stuff he's not used to. But what does the body do? Has an innate awareness for every innate need. It's got to deal with this extra stool. It's going to retain what? Water, right? It's going to retain fluids. What retains fluids is kidneys. What directs his kidneys? Well, you got the pelvic nerve. You also got the vagus nerve, part of your parasympathetics. And you got the lumbar splanchnic. One speeds things up. The other, the parasympathetics, slow them down. But that's going to put extra stress on what? His heart. But that same intelligence knows how to make the heart beat a little faster, slower when it needs to with the vagus nerve. And then his adrenal gland has to kick in some adrenaline. So now his body's going through all of this extra blood flow, might feel fatigued, may feel tired, comes home, may have a headache. The doctor takes him, because his blood's flowing a lot more. We take him to the doctor rather, checks his blood pressure and says, you have what? Hypertension or high blood pressure, and you need to do what? Take a drug. And not that I would tell my son differently, he was raised to think differently. If he gives himself 2 weeks, 2 months, back in his normal routine, what do you think he does with that salt? He'll get rid of it. You know, I cut myself, this is my favorite, no, there it is. My favorite work around the house injury. Didn't have to think much about it. My body knew exactly how much scar tissue, first the scab, knew how much prothrombin and everything to cause a blood clot, without me thinking once about it. That's the autonomic nerve system. Because if I ask you if you have a headache in the evening, you take Excedrin what? PM, you're old enough, you have Tylenol for who? For juniors. How do you spell relief? RLAIDS. We know all the jingles. But we don't know what allows the body to function and heal. And that is, when you have a subluxation, that is the interference that allows, instead of normal function, the body not to adapt to its environment. So what is a subluxation? Sub meaning less than a complete dislocation, or less light, the Latin derivative. So this is what it is, folks. The causes of a subluxation, which is a misalignment, changing the tone of the nerve, are physical, emotional, and chemical stresses. So our purpose, don't worry, you have that in the advanced booklet, so don't go too crazy. The purpose here is to identify, and we do that again in the advanced workshop, what stresses are we under? And some of them we started today reviewing, which is all the ergonomics and sleeping and desk and all of that stuff. But what's the most common physical stress we're all subject to? Anybody know? You ready for this one? You've been through it. Anybody have an idea? We've all been through this. It's not work. It's not a spouse. It's called birth. A normal, natural birth is so stressful. Why? What position is mom in our country when she's giving birth? On her back, with the angle of the birth canal pointing uphill 20 to 30 degrees, with the blood supply being compromised, the nerve supply, because the baby and the placenta are lying right on that. Then, so trying to push that little baby uphill is a challenge. So they pull with 60 to 90 pounds of pressure, and they rotate the head 180 degrees, which is, I'm looking, ouch, at that chart over there. And then they rotate the opposite shoulder 180 degrees, and the normal natural process, which is birth, is made into a delivery. Then they use these things still today. They're called forceps, to help, and resulting in severe misalignment, especially in the upper cervical spine. And if you're born C-section, you think you're opened up like a pea out of a pod. No, you're meant to go through the birth canal. It massages the mucus out of the nasal passageway. So now they have to put a bulb, causing chemical subluxation. And then your head is not shaped going through the birth canal. One of the worst things about C-sections is that you don't get mom's natural flora. So we are about 36 trillion bacterial cells, about 30 trillion human cells, and 100 times that viral cells. We're bags of infection in balance. The balance starts when you go and you get all of those normal bacteria from mom's birth canal. Otherwise, you get doctor skin, mother skin, and mom isn't on an antibiotic because of the surgery. So We see a lot of C-section babies in our practice. And a lot of them, number one, they may have torticollis, they may have behavioral disorders, because without those normal bacteria, you're more prone even to emotional issues, adaptive issues, depression, and dementia. C-section babies, which is crazy. And there's a way to restore those bacteria, without doubt. And that's what we teach, how to keep yourself balanced. So, this guy still has his ring on. Pretty upsetting as he's pulling this baby's neck, and that's not the best way to begin life. So, I'm going to ask for your help, folks, in a couple of ways. We want to help more kids. We want to help everybody, but this is JD. JD had behavioral issues. He had gastrointestinal issues. He could never do a split like he's doing there. It was Dr. Valente's patient she took care of. Chiropractic changed his life. I'll let you read that later. But they got here because somebody read a review. So you have our little Google thing. You can put your phone on there when you get a chance. Give us a few kind words. You also get our texts. It does make a difference.